So, first of all, what are the main goals and values of North Korea healthcare system and South Korea's healthcare system? Well, in North Korea's healthcare system, the key goals and values are firstly that there should be free and universally available healthcare for all citizens, funded by central or regional government. So that applies to all levels of healthcare, primary, secondary, and tertiary, and maternity as well. And secondly, in North Korea, there is an emphasis on preventative medicine rather than curative medicine. Obviously, preventative medicine doesn't require foreign exchange to be used, whereas much curative medicine does require the import of pharmaceutical drugs and so on, and medical equipment which comes from overseas, and therefore involves the use of hard currency. In South Korea, the emphasis is not so much on disease prevention, but on the curative facilities and resources available for that. So the main things are therefore to ensure access and availability of healthcare services at primary, secondary, and tertiary levels for all citizens. And then secondly, as far as possible, to fund a person's healthcare through the contributions they make as citizens during their working lives through insurance schemes. And of course, parents are responsible to pay for the healthcare of their children. That doesn't mean that South Korea has no public health programs, but it means that the focus is much less on those and much more on the curative facilities if people get sick. So you can see a difference in the emphasis between North and South Korea. One is on much more on prevention in North Korea, one is much more on the curative services available in South Korea. In terms of the institutions of healthcare delivery, in North Korea, the primary care is delivered by a healthcare professional, doctor, at the level of every village or local community. That means they're ensuring primary care for about 130 households or about 500 people. The point is accessibility, and that there is somebody available to deal with the enormous number of cases or issues that come up in people's daily lives. And then in North Korea, there's a secondary level of care, which is a hospital serving a city or a district or a county. There's a tertiary level of care provided by a provincial or municipal hospital, and then there is quaternary care, which is the most specialist level of care for certain cancer conditions and so on, or other complicated medical conditions, and they're provided in North Korea through the Pyongyang Medical School and specialized hospitals. In South Korea, the funding of healthcare delivery is largely through insurance programs. There's a national health insurance program. It's a compulsory system, and contributions are made according to the ability of a person to pay during their working lives. And benefits are not linked directly to the size of the contribution. It is an insurance system. There's also a medical aid program. The government can pay all medical costs of patients who are unable to afford health care. And there's also a long-term care insurance program which aims to alleviate the financial burden on unpaid family caregivers. So primary and secondary healthcare in South Korea is delivered through privately owned clinics and hospitals and funded through these mandatory health insurance schemes. And tertiary or specialist care in South Korea for cancer or other complicated surgery is delivered by university or large hospitals, which are privately owned and funded by government. So how can you bring these two rather different models of funding and delivering healthcare together? So here are some practical suggestions. So we could look to see South Korea increase the resource allocations for community-based public health programs to give them the equivalent resources and effectiveness for preventive medicine as in North Korea. Obviously, there's a huge benefit in preventive medicine because if you can prevent people drinking too much alcohol or eating too much and becoming obese or whatever it may be, you're going to save an enormous amount of public spending if you can achieve that. So prevention in so many ways is better than cure, both financially and for the person's own individual health outcomes. Secondly, one could make primary healthcare free of charge to all citizens as closely as practically possible to where they live. So that's already there in North Korea. That could be something that the South Korean government could aim to achieve as well. It would obviously cost the South Korean government and taxpayer a significant amount of funding to do that, but it does mean that first of all you bring it into alignment with North Korea, and secondly there is a certain sense in which all people, all of humanity, every individual, every person on the planet has an intrinsic worth, and that is recognized when you ensure medical help to every human being on the same basis. And thirdly, there could be an integration of healthcare professionals from both Koreas in terms of training and license to practice. So the training programs in both Koreas are slightly different but cover much of the same material, and there may be some additional training needed in North Korea around advanced medical equipment which is available in South Korea, but by and large bringing together the training programs for doctors in North and South Korea should be achievable. And then fourthly, there is a possibility to centralize and simplify the purchase and use of pharmaceutical products. So you could have a unified Korea government committee set up with members from both North and South Korea to agree on which pharmaceutical companies they're going to use for which products, and simplify the purchasing of pharmaceuticals for use in both Koreas, and get the pharmaceutical products more cheaply just because of the volume in which they're being ordered and used. And the fifth suggestion is to bring together the financial schemes used in both Koreas, but this would be the most difficult area to discuss and negotiate between the two Koreas. How much should people pay for their treatment, and how much is it just and right to ask people to pay if they have a particular medical condition? Now, where the medical condition is brought about by personal behavior and personal choices, there may be a particularly good reason to say that people should contribute substantially to their own treatment. So I think the use of insurance schemes and role of patients making a contribution to the healthcare costs, particularly for people who are in regular employment, there's a case for doing that. And I think somehow keeping the overall cost of healthcare within reasonable bounds is extremely important. So I think bringing together the two healthcare systems is definitely feasible. There could be some benefit to both North Koreans and South Koreans from doing that.